right business. We do, and we have identified several ways that we have been able to continue to write business. I hope everybody's taking advantage of those. We do have the chart, which is the SCP tables that we've been reviewing internally at A&B with all of our direct agents and also with everybody on these calls to make sure everybody is comfortable with those SCPs and able to access them. So just to review a little bit of what we talked about yesterday in our internal meeting is just some of the SCPs that you're able to access, making sure that you understand those SCPs and you're able to get your clients into them and be able to access them. So one of the big things that we've identified in some of the big news that's come up is when it's related to Cobra. The HHS had made an announcement. We confirmed it with senior management yesterday. And anybody who is on Cobra is going to have an opportunity to continue to buy a policy on the exchange with a subsidy or without a subsidy. Now, my advice is to utilize healthcare.gov for all of those. What happened is on May the 2nd, the CMS posted a document allowing and giving people more time to enroll if you had Cobra, because the Cobra conversation or the information that was passed out to Cobra recipients was not adequate to inform them that they had to make a decision during an AEP or they were going to lose their potential to get into an Affordable Care Act plan and access a subsidy. So if you're talking to anybody that has a COBRA policy, know that what we need to identify is did they enroll? Obviously, they did not. And you will have until July the 1st to enroll those people and access a subsidy on their behalf. So that's a big one. That really opens up a lot of opportunity, especially for the bigger group producers that are on the call today. If you're doing any fact finding, you're doing prospecting, you're seeing people that have that COBRA, know that there is a huge opportunity for you to enroll them and allow them to access their subsidy. We're waiting for some final guidance. There's been some talks about a chronic condition SEP, and as that becomes an available tool for us to use, we'll let everybody know probably on the next week's call, or if we get clarity on that before next week's call, we'll make sure that we tell everybody about that as well. The basic SEPs that we've been using, the loss of group, loss of minimum essential coverage, still an active way for you to pursue business. Again, now we have added the COBRA. I do want to talk a little bit about the misrepresentation. The misrepresentation SEP that we have been dealing with has changed slightly. Now, misrepresentation, as we all know it, would typically be with a benefit being disclosed incorrectly. And that is what you have to gravitate to if you're going to access the misrepresentation. In the first 2 weeks of this post AEP marketing, we were allowed to, if someone said I tried to enroll in I enrolled in a Humana policy, I found or identified that my doctors don't take it, and at that point, you were able to enroll them on the marketplace with a misrepresentation. However, the marketplace has started to crack down significantly on that, and any of those misrepresentations that you're coming up against really needs to be geared towards a product. And part of that product, not the network. What they're doing is they're just not allowing it. They're informing our clients that they will be escalated. It'll take 30 days before they get an answer, and if it is a network issue, it will probably not get passed. So what you're going to have to do is identify a reason. Typically, and the best way for you to identify that misrepresentation is how the drug coverage is going to be treated. So I want everybody to be aware of that. You need to really peel back the layers of that product or the benefits, and that's what you're going to have to latch onto if you are calling healthcare.gov and trying to get a misrepresentation SEP. Now, I know many of you are saying, well, what happens if they're off exchange, they're non-subsidy eligible? I would not advise doing paper applications with Blue Cross on the misrepresentations due to the time lag, due to the documentation that's going to be necessary for that. It will be a smoother and easier process for you to go through that by utilizing healthcare.gov. So what you'll do is do a three-way call with your customer. Tell the caller at healthcare.gov about the scenario, what has happened. Make sure that that event or that identification of the poor acting product or the RX coverage not being what the client thought it was going to be has happened within 60 days, and then they will give you that SEP. So it's a good thing. You just have to make sure that you're doing it correctly. You can't say, I don't like the product. You can't say, well, I just don't like my agent, or I just want Blue Cross. You are going to have to gravitate towards the benefits. And again, the RX coverage is the easiest way for you to access that. We are still able to use the Medicaid if someone was thinking or thought that they were able to get Medicaid and then you have informed them that they don't qualify for Medicaid. That is still an option as well. We are utilizing that on a regular basis. The non-calendar plan year anniversary is coming up more and more. The reason that's coming up more and more is because carriers like Assurant, who have a non-calendar year anniversary date, you can access those folks and write them a policy as well, access a subsidy, and that could also be done at your leisure. Very easy to do those. Do be aware that, again, it has to be a standard traditional policy. Short-term policies that do not meet minimum essential coverage are not a reason to enroll in a subsidized health plan. There are some carriers that are out there that are saying that they will take people who are coming off a short term, but those are for off-exchange policies only. What Humana is saying to their field is that if you have a client, the client is losing their short-term medical policy, they will take them as a off-market-based plan. However, Blue Cross's rules and Blue Cross's perspective of that is because it does not meet minimum essential coverage, they are not allowing someone who is on a short term that is terminating to move to a qualified health plan with Florida Blue. That is not an SEP. So you have to be aware of those kind of things and be comfortable with them. So there is a lot of opportunity for writing people. We just have to take the steps to identify if they do have an SEP, and then if not, of course, propose a secondary solution. A lot of the people that we're talking to, a lot of the folks that have Blue Cross now are all in an SEP. Anybody who has a non-qualified health plan would be able to enroll. So anyone who has a 533, a 530, a 505, and they're going to be getting their rate increases. Now remember, rate increases for Blue Options programs happen in July, and that is our anniversary date. So you are able to access an SEP for those folks. People who are on a hospital surgical style plan, well, those will have an SEP in August. Please keep in mind that you will not receive full commissions on those plans. Those are not full commissionable sales. There is a transfer commission that would be paid for those folks. And if you can identify that they're currently a Blue Cross member, know that the original AOR on an individual policy only, group does not matter. It will only be a transfer commission. So those are, some of the biggest ways, some of the biggest things that we're accessing, what we're identifying, what we're able to do, and how we're able to enroll those folks. Now, what we've also were released was an agent service bulletin just the other day, and those agent service bulletins were adding of dependents. Now the process has changed slightly. So with dependents, there is a document that you need to utilize, and with that document, I'll pull it up here for you in a quick second. I'm just pulling it out. And that way, what you'll do is you'll use the agent service bulletin for some guidance. You can see this agent service bulletin number right here, A14107. Then what we have is we have two forms that went along with that. An ACA change form for adding dependents or a spouse or adding a child. So you have both of those forms that you need to utilize. Make sure that you get that agent service bulletin, you read through it, because if you are going to be adding someone, you need to follow the appropriate path. And that's something that's very important that you do. We've been getting a lot of questions about changing date of births, changing information on the marketplace, and that you're having a cumbersome process doing that. Make sure that you remember you do have to change any of those demographics with both Blue Cross as well as the marketplace. So that's going to be important that you do that as well. I want to also remind everyone that you really need to be guiding all of your members, all of the people that enrolled to the My Blue Service portal. this is going to save you a lot of headaches. Once a client enrolls and they are past their effective date, and all of the stars have aligned, then at that point you're able to access the My Blue Service registration portal. So if you come to the Blue Cross website, then what your client will do is they will click the member registration, follow the steps here, and that's going to give them access to My Blue Service at that point. Now, My Blue Service is going to give them all of their claims history, the place where they can appeal claims, where they would have access to all of their forms, even pay their ongoing bills. So it is in your best interest to make sure that your clients are educated about this tool. It will save you a lot of headaches. It gives and empowers your clients to have some responsibility factors on their policy, and it is advisable. When you're making your outbound thank you calls, customer service calls, if you have a CSR team that's working with you and your crew, then that needs to be part of the conversation, making sure that your client has gone to the Florida Blue website, clicked on the member login, and then registered. Now, once they've registered, again, they will have a lot of different options, a lot of different things that they can do when they're there, and it will save you a lot of headaches. We're also getting a lot of people that are having experiences where they're having claims problems. They need documents. Remember, the member forms are accessible to the public on the member form location as well as in their My Blue service. So you can find those information reimbursement forms in the form of claim forms, appeals, and grievance forms as well. Now, as our clients start using their benefits more and more, you are going to start having headaches. And the reason you're going to start having headaches is because, as most of your clients probably don't really listen to the letter of the law of the things that you're saying, and the experience that you told them to discuss with you and call you if there is an issue, they may be experiencing problems. Really, the best way to attack those problems is going to be to take them head on, to find out and identify what that problem is, speak with agent services. What we've been seeing is the identified problems that we're experiencing are typically with problems with understanding the network. We have a video on utilizing the provider directory. Also in that customer service call, I would advise you making sure that you have a clear understanding and your client has a clear understanding on how to use these provider directories, because as many of our clients have gravitated towards a lower cost solution, and when I say lower cost, I mean Blue Select. What they're experiencing is that with admitting privileges and the way that the Blue Cross policy works, they can be having a poor member experience. And it's just education. Unfortunately, it's an education piece that we have to take a few extra steps. If you're talking to someone that may have purchased a policy on Marketplace without your assistance, they bought Blue Select, they're not happy with it. Again, most of it that we're seeing is in utilization of the policy and just not knowing that they have to go to particular doctors. Because quite clearly what's happening is that your clients are going to the provider directory, they're looking for, Dr. Jones, for example, not taking step 2 with selecting their insurance plan. And then when they see Dr. Jones, and let's say this doctor, this general practitioner is their doctor, they're going to say, oh, Dr. Cheryl is in the network. Now, if that particular client has Blue Select, they're actually not in the network. But for our standard client, they're not going to understand what all of these plans accepted means unless you give them a little guidance. The easiest way for them to do that, as all of you should know, is in this drop-down box, select what they have: Blue Select, Blue Options, or Blue Care. Remember, it is Blue Care HMO, Blue Select, or the Blue Options. And then, for example, if I was looking for Blue Select, that's going to significantly change my results, and then Dr. Cheryl will not be represented, and our first Dr. Jones would be Dr. Claude. So as you can see, it can be confusing. We understand it can be confusing. The problem is that the clients are trying to take the onus on themselves and then giving themselves a poor experience just because they don't understand. So a little education goes a long way in making sure that they understand, that they're comfortable, and that way you give a pleasurable member experience, so that way renewals are easy and referrals are even easier. And let's face it, that's the best way we can all build our business is by actively pursuing referrals from our best clientele for a job well done. Now, however, if you're not doing a good job, not going to get any referrals. So there is always that. Okay, question came through. I have a client with a non-marketplace Affordable Care Act plan who is having a baby at the end of May. He will need to add pediatric dental, a qualified dental plan. What is the best way to do this on IST? And if so, what date do we use? Date of birth or first of the month following the date of the event, the date of birth? Well, when after the baby is born, that's going to be your life event. That's when you can add that policy, and then you can purchase a separate standalone qualified dental plan at that point. You can use the add-on forms if that's an off-marketplace policy. And you will, about adding the qualified dental plan, the pediatric dental, I don't think they're going to force you to purchase that dental on the pediatric dental because we've added some children to some other policies already, and there wasn't that forcing in of the pediatric dental. Upon the renewal of the policy, I think the pediatric dental will have to be added. However, there is some guidance that has come from Florida Blue about pediatric dental being completely separate starting next annual election period. So the P plans are going to go away for next annual election, and then you would just have to add a qualified dental plan. So it'll be a separate little policy. It'll be 2 steps in the process, but it'll make it easier for everybody to understand. So getting back to answering your question, after the child is born, then you would add the newborn at that point, and then it would be added on the first following that addition. So should have no problem. It is on the form adding the newborn. You say you have to add pediatric dental. You need to add pediatric dental, but we've been flying under the radar with the pediatric dental up until this form. So just follow the steps on adding that dependent in the the ASIB right here, and then utilize the add-on for the child form here because it is an ACA policy. It is a qualified health plan. You're just not going to have to be dealing with any type of subsidy. Because if you were dealing with subsidy at that point, then you would have to go back to the marketplace, log in using the marketplace account, and then do the life event at that point. Now, also, on the same lines of that, just getting into that a little bit further, and your customer service calls when you're talking to your folks, you need to make sure that all of them have created themselves a marketplace account on healthcare.gov. You need to make sure that they've used their identification number, they've gone through here, looked up their subsidy eligibility notice, and created a username and password. Now, the reason why that is so important is because that's where life changes can be made. It's where an easier path for enrollments can be done and changes, and that marketplace account needs to be completed. Many of your clients are not completing the documentation that has been required on subsidy eligibility notices, and that is something that you are going to want to push them to get completed. I asked senior management yesterday if that's going to cause people to lose their subsidies and what's going to happen with that if they didn't provide the documentation that was requested on their subsidy eligibility. And there is no formal guidance at this point. But as we all know, what could happen? Well, they could lose their subsidy. It clearly states it on there. If you haven't returned your documentation in by June such and such, you could be eligible to lose your subsidy. And we don't want that to happen because let's face it, on a $1,000 policy with a $500 a month subsidy, if they lose their subsidy, they're going to lose their policy because they're not going to be able to afford that. And if that does not provide them an SEP in order to enroll in a new policy. So you have to keep and you have to be conscious of that. And I would advise in your customer service calls, take it in a multi-prong approach. First question would be, did you get your cards? Did you enroll? Did you get everything completed? Have you registered for MyBlue services? Are you comfortable with searching for a physician? And oh yeah, by the way, did you register your account? Do you have a username and password? And did you provide all the documentation? Those 3 areas are going to cover your behind, CYA, and make sure that you've got, a much less ringing phone with kinds of issues, and also making sure that there's a better experience and you have a longevity of the client. All right. Last thing I want to kind of talk about is people who have had payment issues. As you know, we still are experiencing payment issues, and many of your clients with 5/1 effective dates that are continuing to try and pay now are not able to pay. They all received a bill, and the cutoff was officially the first, technically. They did allow payments until the 4th for AEP business, and was illustrated to everyone that they would take those payments until the 7th. I know that that sounds all kinds of crazy. It's all over the map. But what you realistically need to know is that if your client hasn't made a payment for a 5/1 effective date by today and they didn't attempt to make that payment, they are not able to make that payment. If they've called HPS in order to make premium payments as of the 4th, they were not able to do so. Anybody who made a payment after the 4th, we need to monitor those policies closely to make sure that they do get issued. What has happened is HPS is taking the payments, and it was even taking payments yesterday in some instances. And the problem is that those will not hit their account in time to make the cutoff, and there's a likelihood that those people will never be made effective. So you do need to closely monitor your 5/1 effective dates. If you are doing customer service calls, those would be the ones that I'd be focused on, and making sure that they have paid, they are issued, and they have proof of payment. If they do not have proof of payment and they did attempt to pay before the 4th, you are going to have to communicate with your manager or with Gigi about how we can get those policies placed in force. It is something that senior management doesn't have a process for, but we are working with them in order to create one. So know that there's solutions out there. There's stuff that's coming, and we're really trying to stay on top of it. And this is where you, as agency directors and agents, need to really be tracking and monitoring your sales, your payments. You need to really stay on top of that because of all of the craziness that's going on with healthcare.gov and all the communication back and forth from the government and who's collecting payments and so on and so forth. And I'm surprised I still have any hair left in my head, but it's going quickly. All right, so I'd like to know if anybody has any questions about payments or SEPs at this time. Does anybody have any questions that you would like us to address? Any concerns that you're coming up against? Easy enough. Gigi, do you have anything else that you think that I should cover for the team? Okay. All right. Well, if nobody has any other questions, that just means we're staying on top of everything. We're staying in front of that bus as it's driving down the street. I'm going to let everybody go today. Next week, we will have some other communications, hopefully more information for everybody. I want everybody to keep up the good work, really use the customer service calls as an opportunity to sell more and to give yourself more opportunity and really start lining things up for next year. Just to kind of cap for what we're going to be doing over the next few weeks and the next few months. We're going to be doing a lot of training on new products as they are starting to be released. We are going to get ahead of the curve on the Medicare programs and what that's going to be and the opportunity that we have there. Gigi and myself have a meeting tomorrow with Blue Cross to talk a little bit about some of the opportunities that we'll be able to provide to everyone and really make sure that everybody on your team is prepared for both under 65 AEP as well as under 65 moving forward. And then, again, building opportunity for SEPs, identification of those SEPs, and being able to really do a lot of business still throughout the summer. So I want to thank everybody for their time today. And if nobody has any other questions, I hope everybody has a great day, and I'll talk to you next week. All right, everybody. Have a great day, and thank you for your time.